questions for Dr. Bu. Actually, 69 of the folks who have passed so far from COVID-19 were either diabetic or obese, which are both pretty common health conditions in Louisiana. To what degree should the average diabetic or the average person who is overweight be concerned by those numbers?
Well, I mean, I think that in general it's a cause of concern for our population. You've been hearing a pretty consistent message from us that everybody has reason to be concerned and to take actions to protect themselves and their families from COVID-19. We unfortunately announced a death in a 17-year-old yesterday. I mean, we know that the people who are at the highest risk are the people who are in the older age group. But we also know that people with conditions like, as you're seeing, diabetes, kidney disease, and obesity are also at really high risk for bad outcomes. And so to the extent that you're somebody that has those conditions, we want you to take those steps to really stay at home, have somebody else do the shopping for you, limit your exposure to people who are sick, wash your hands frequently, all those things we've been saying. But even if you're not in those groups, we want you to do all those things for the loved ones around you that we know have those conditions. We want not only to not see as many hospital admissions, we want to see the rate of death decrease as well in the state. And the only way we can do that is by taking these measures seriously and thinking not only about our risk, but the risk to our family and the risk to our neighbors, as you've heard the governor say.
Just as a follow-up, were those 69 people, were they like extremely diabetic, extremely overweight? Do we know the degree of that?
So I don't know the specifics of each one of those cases. What I'll say is I don't think that we're necessarily seeing just extremes. I think there's reason for everybody with those conditions to obviously always take control and have the optimal health they can. But most importantly right now, to really try to limit access to people who are sick and exposure.